So as we age, I'm sure everyone realizes the point where they realize that they can't take their movement for granted. Now, I'm sure everyone can relate to pulling a muscle over time. But what if that muscle stiffness is indicative of something more? For many people, loss of control means loss of independence. And this is actually clearest for people living with Parkinson's disease, which affects over 1.1 million people in the US and creates a heavy burden on our healthcare system. Shockingly, the way that this is still done is still subjective. A physician will manually move a patient's limb and estimate rigidity based on feel using the UDPRS scale. This means two doctors can disagree on the treatment for a patient, with one recommending medication and the other a brain implant. Do we really want our loved ones to go through this subjective care? Guessing shouldn't be the standard. As one of our advisors said, every missed adjustment is another day, if not weeks, added to the patient's journey to recovery. We cannot treat what we cannot measure. MyoVerse is made to close this gap. We're building a neuromuscular sensing platform that turns subjective exams into actionable results. In other words, we detect, decode, and demystify your muscles. And it's super simple. Connect the device, strap it on the patient, and instantly see your muscle activity in real time, down to the tiniest tremors invisible to the naked eye. And for physicians treating Parkinson's patients with deep brain stimulation, this allows them to compare their stimulation settings and track the responses across visits, eliminating the guesswork. We're also promoting faster care. We're estimating that we can reduce patient visits up to 40%, with up to 3 times faster detection of early onset symptoms and saving some money for each patient. We're not just turning this into an idea, we're making a prototype over multiple iterations to bring this vision to reality. And we're combining our platform with strategic clinical partners to integrate it into current and future studies. We're strongly positioned to succeed in high acuity motor decision workflows, but our platform naturally expands to other neuromuscular disorders. Hospitals and clinics are our buyer, and using existing CPT codes, the benefits extend to the patients. We're serving the platform as a hardware, and we offer an AI-based software analytics solution for longitudinal tracking and data aggregation. Our team is strongly positioned to succeed with experience in wearable sensing, biomedical engineering, clinical operations, and business strategy. And we're supported by a strong team of advisors that have experience in entrepreneurship, commercialization, and the clinical and regulatory pathway to help reduce that risk. In 2024 and 2025, we focused on traction and validation. And over the next year, we're planning on more validation with a regulatory prep and multi-site application. And our McGinnis Prize is going to help us take us that way. Thank you.
What is your clinical pathway? What is your clinical pathway?
Our clinical pathway. So right now we have multiple letters of intent as seen on one of our slides. And one of them will be for a clinical study as well. And a doctor has agreed to have us perform our device on multiple patients as for clinical data.
Are you looking to measure, you're just trying to create like a feedback loop for therapies for indicate, things that would indicate or create muscle rigidity? So you're trying to create a feedback loop, essentially?
Yes. Getting rid of that the subjectivity in that feedback loop allows doctors to be able to find what is the best optimal personalized treatment plan for that patient. And DBS is one of those fields that is still exploratory but has massive implications if we can show that it works. We just need to be able to rapid the treatment plan. So we're working with a collaborator, a neurosurgeon at AHN, in order to start a clinical study, and we're using a PA Med grant to do that.
Mm-hmm. Yeah. So you really need to work with the therapy. I mean, you need to find the partners who are delivering therapy. Mm-hmm. And so good luck. This is actually what Jerry McGinnis suffered from in the final days, was Parkinson's. It's quite overwhelming. So thank you.
Thank you.
Is this something that's constantly worn and tracked, or is this something that's used in the hospital with the doctor?
So actually, the device itself is something that is in the clinic. However, because the form factor allows it to be portable, if this was something that you wanted to deploy to, say, a mobile site, something like this could make it possible. Yeah.
How are you protecting intellectual property, or is that possible? Have you already filed?
We have submitted an invention disclosure, a provisional patent as of last December, and we are doing our homework to figure out the best regulatory pathway to get this into a clinical workflow, ideally 510K.
Is that hardware predicated on something that's, is this a sort of a improvement patent, or is this straight out of, brand new technology that you've developed?
A combination of engineering design using flexible circuit boards with rapid prototyping that other major medical companies haven't really explored over the past few years. So we're taking advantage of those techniques and turning into a wearable form factor.